and maybe how long you've been in the field. That would be great. So we can start with Gabe. I think we have the slide. I think it should be there. The slide of the panelists, if you have it. Wonderful, thank you. So we can start, we're gonna go from left to right. So we can start with, I don't know why it's not showing the whole slide, but that's okay. You know who you are. So we'll start with left, behavioral framework. Go ahead.
Hi, everyone. My name is Brittany Rader. I am president of clinical services at Behavioral Framework. We are an in-home ABA therapy provider to individuals diagnosed with autism spectrum disorder. And I've been in the field since 2010.
Good evening. My name is Adetokunbo Ajayi. I go by Tux. I'm currently the clinical director at Behavioral Framework. I have been in the field for a little under 8 years and a BCBA for the past 5.
Good evening. My name is John Barrero, and I'm the professor at UMBC, where I'm director of the Applied Behavior Analysis Master of Arts track. I've been in the field for a little over 25 years now.
Hi, everyone. I'm excited to meet all of you. And so my name is Nirala Senger. I am an assistant professor at UMBC, and I have been in the field for about 15 years. I have done clinical work for most of that time and also research. And for the past few years, I have been in academia.
Hi, everyone. I'm Erin Schaller. I work for Little Leaves Behavioral Services. I am the Career Development Manager. I'm a BCBA myself and a proud alumna for UMBC graduate program, Dr. Barrero. I've been in the field for a little over 14 years. And at Little Leaves, we work with young children with autism ages 18 months through the age of 6, full-time center-based services and part-time home and community. Happy to have me. All right, thanks for having me.
Hi, everyone. My name is Diana Lay, and I am currently a behavior specialist at Little Leaves. And Dr. Steve Young was actually my advisor when I was at Maryland, and he was the one who referred me to Little Leaves. So I've been working in the field since 2015, and I recently just got my master's. So happy to answer any questions.
Wonderful. Thank you all for those introductions. And Diana, I didn't introduce myself, so I'm glad you mentioned my name. I'm Steve Young, an advisor in the psychology department, as Diana mentioned. So, all right, well, we're going to go ahead and get started with our prepared questions. And again, students in our audience, we really want to hear from you. So feel free to drop those questions in the chat box for us. So our first question is kind of more of a general question to talk a little bit about what exactly is the field of ABA therapy, kind of providing maybe an overview of its mission and who the field serves. So anyone can jump in.
Okay, so I'll kick things off. Again, my name is John Barrero. I'm a faculty member at UMBC. Applied behavior analysis got its start in the late 1950s. And the primary audience, the primary group of individuals who have benefited from applied behavior analysis services has generally been in the domain of intellectual and developmental disabilities. So the panelists that you see here today are those individuals who have made a career out of improving the lives and the quality of life of persons with disabilities. And I think that's probably one of the areas for which applied behavior analysis is best recognized. But before I conclude, I would just like to say that there are a number of potential applications of applied behavior analysis. And the panelists here have a particular area of expertise, but if you're interested in the science of behavior beyond applications to persons with disabilities, there are a number of opportunities that are available.
Hey, anybody want to add anything else to that question for us?
Sure. Thank you, Dr. Barrero. It was a great overview. I work for Little Leagues Behavioral Services, and I think probably speaking for behavioral frameworks also, we use applied behavior analysis specifically in the context of young children with autism, or actually adults. I think at Behavioral Framework, you work with older children and adults as well. And so ABA has been used in many different other contexts for safety, for drug, opioid abuse, things like that. But we apply it to young children with autism to help them improve their communication skills, play skills, to socially interact with others, to tolerate being around others. These are all very socially significant behaviors that how we use it in the context of intellectual disabilities and specifically with autism.
So piggybacking off of Erin, so one thing I always ask when I first got into the field is, what does the applied mean in ABA, applied behavioral analysis? And it actually means that what we've taken from like laboratory settings, like working with pigeons and rats, we apply it into the everyday life. So that's kind of what we do.
Well, that's a wonderful lead into our next question, is kind of asking, what does it look like? What does ABA therapy actually look like in terms of a practice? What are the actual functions that, say, an ABA therapist does perform when working with a child or adult?
I'm happy to try this first. I'll try to answer this first. Again, I'm Mirella Singer. I can think of at least two different ways of answering this. The first one is that, broadly speaking, what behavioral psychologists do is that they identify behavioral goals, but which can be done in many different ways. So, for example, they may conduct assessments and realize that a child has language deficits. They may talk to the parents or other caregivers and identify some common goals that they want to work on for their child, such as potty training. And then once they identify those skill deficits or behavioral excesses, they develop interventions that are highly individualized, and they're meant to meet each child's goals, and they're meant to build on each child's strengths and also build on what is reinforcing or rewarding for each child or each adult. And we typically do that by arranging the environment in a way that supports learning. So, for example, if a child has language deficits, a good starting point, depending on their age and skill level, would be to identify things that they really want and teach them to communicate in ways that gets them access to those things that they want. So highly individualized and meant to teach skills that are adaptive or to reduce behaviors that are highly problematic. And I think I kind of merged my two ways of thinking about this into one. So that's probably better than giving two separate answers, and I'll stop there.
I think specifically for an ABA therapist, their main function is to implement treatment that's written by the board certified behavior analyst. And those treatments are everything that Mirella just described. So that every day in and out, the behavior therapist is trained to integrity, to feel comfortable and confident in how to implement everything the child needs to learn.
All right, thank you so much. We have a question in the chat box. I'm going to just go ahead. Again, we want to make sure we're addressing the student questions here. So the question is, could someone touch on the path they took to become a professional in the field? And this is one of our prepared questions, I think. So wonderful timing. And it says, I'm currently a registered behavioral technician interested in working with young children and wondering how to move forward besides becoming a BCPA. So maybe we could step back a little bit and first talk about how you become a registered behavioral technician and what that is exactly. If somebody can maybe tackle the RBT first, and then we'll come back to Rachel's question here that's a little bit more in depth, digs a little bit deeper beyond the RBT. She's already an RBT, but for those folks who aren't, can someone share maybe what are the what's the path to becoming a registered behavior technician? What are the qualifications, training, that kind of thing?
I'm happy to answer this one. We deal with this a lot within behavioral framework. So there are some minimum requirements: high school diploma, 18 years of age. The best place to start is the BACB website. They're going to have the most current information about the RBT credential. But once you have those minimum requirements, the first step is completing the 40-hour training. And there's many, many ways to go about this. There's many companies that offer variations of the 40-hour training, but they are all based in ABA principles. So step one is completing the 40-hour training. After you've done that, you have to complete a skills-based test with a BCBA. So you're going to be required to perform certain skills that align with the RBT task list. Once you complete all of those accurately and the BCBA signs off on your competency assessment, you then have approval to submit your application to then be approved to sit for the computer-based test. So then once you're allowed to sit for the computer-based test, you take that test, you pass it, then you've obtained the RBT credential.
And just so the BCB, I know what it stands for, but just for the audit, BCBA stands for?
The BCBA is the Board Certified Behavior Analyst.
Wonderful. Any more on that question?
It is a process that some companies help support and pay for your training and your credentialing. And that is always a good sign to look for if you are interested in the field and becoming an RBT, for companies that do support that. We do at Little Leagues because we want to train you the best possible. And so I put a link in the chat if you want it, the one that Brittany had just mentioned, the BACB.com, specifically for the RBT credentials, so you can get all the info you need. And that website in general will help walk you through, and I refer staff to it all the time for a lot of great information if you're interested in this field.
All right, thank you so much. So maybe you could talk about kind of the realities of being an RBT, the challenges and rewards of it. I guess Diana could really address this question maybe first, and then folks can follow. Kind of what have you found to be most rewarding about a career as a behavioral technician, and what would you say are some of the challenges?
So yes, I started as a behavior technician and later on became a registered behavior technician, where I work closely with my supervisors and my BCBAs who help supervise me working with children directly. And then moving forward, I took a 3-year gap, and then I decided that I really wanted to do this for probably the rest of my life. And working on getting a master's degree in becoming a BCBA. I guess the challenges that I faced when working as RBT is, just not knowing how every day is going to be mapped, because their behavior changes every day, working with young kids. So we never really know what to expect, but the BCBAs do a great job in training you and supervising you so you can feel more confident working with kids or just anyone.
I think to continue off of that, there's lots of rewarding things about being in the field of ABA. I know many of us from a young age probably said, I want to change the world. I want to make meaningful change when working with kids. I want to help people, where you literally get to do it in this field, especially as an ABA therapist. You get to see those life-changing moments for the individual that you're working with. But of course, that comes with having tolerance and patience, and it's a really hard job. I think it's arguably the hardest role in the ABA model as it currently exists, being an ABA therapist, because like it was mentioned, some days it's tough. The behaviors change, or you're not necessarily sure what it's going to be like, but it's absolutely rewarding to be a part of those big and small moments, whether it's you're helping a family to figure out how they're going to sit at a restaurant and have a successful meal, or you're there when the child says their first word and they're 6 years old. It's like those big and small moments that you get to be a part of. So it's rewarding, but it definitely comes with its challenges.
Yeah, and I think these are all great points, and I think those rewards are really incredible when you help make such meaningful changes in one's life. And I just want to add that I think it's one of the few jobs in psychology where you can start working as an undergraduate student. That is how I started, and I think those immediate rewards for a lot of students who start working in the field, really helps them stay engaged. And if you do try it out at this early career level, the other good thing is that I think the opportunities to advance, especially if you're considering or thinking about going to grad school, are pretty immediate, and they're real. With a terminal master's degree, you can work as a BCBA and have a really good, successful career, make a really good income, and continue making all those changes, and maybe be in a role that is a bit more, that is easier in some ways, because you're not the frontline worker at that point. You are the one designing and implementing treatment. But I'm sure there are more questions about that BCBA role that will arise later. So I'm not going to say any more about that, but it's, in summary, it's a job that is available. There are a lot of job opportunities at the undergraduate level. And if you decide to stay in the field, there are opportunities to advance very, very quickly.
Well, that's actually a really great lead into the benefits of earning an advanced degree in applied behavior analysis. You sort of touched on them briefly there with the BCBA, but what are some of the advantages to doing an advanced degree? What types of courses do you typically take with a master's degree in ABA? Are there practicum experiences built into the program, that kind of thing?
I can start with this one. So with respect to the advantages of an advanced degree, the way that I think that it was appropriately framed before, when you get those entry-level experiences as an RBT, I think those are absolutely essential to determining your success as a leader with more advanced degrees. Stated differently, it's important that you know how to do it so that you can effectively teach others how to do it. And what you do in the role of BCBA is you mentor and guide and teach the individuals who have the RBT credential or perhaps BCABAs, so that they acquire the skills that are necessary in order to provide the best services for the families and children who are being served. In terms of the coursework at the graduate level, it varies to some degree across institutions. But what is consistent across institutions is that each graduate training program is required to offer very specific content in very specific domains. So for example, at UMBC, any school that offers what's referred to as a verified course sequence, or VCS, is required to teach 45 hours of ethics, and 45 hours at UMBC translates to one standalone course. Similarly, you're required to have 45 hours in basic behavioral principles. So we teach courses that map onto the requirements of a verified course sequence. And then once the person has that credential, they are then in a position to serve as a designer of behavioral assessment and interventions, as well as a trainer and mentor to individuals who are aspiring to obtain the degree, the advanced degree at minimum a master's, and the board certified behavior analyst credential.
All right, thank you so much. We have a couple questions we're going to go to from our students. The first is from Drake asking, are there any times when working in ABA has been difficult? We addressed that, I think, a little bit earlier, but if anybody has any other thoughts or insights on that.
I tell people every day that it is not an easy job, but to have the passion to, as it was mentioned before, to help others, and a love for working with children, working with people, and really appreciating data-driven decisions. And so applied behavior analysis is very evidence-based methods. And so I've worked in schools, I've worked in homes, worked in centers and hospital settings, and ABA might look a little different across all settings if you've been in a school versus a medical center for ABA. And data should always be a part of it. So if you those that love working with children and love and appreciate data-driven decisions, I find do well in this field as a BT and RBT. And often for those coming out of college or in your senior year, getting a feel for what this is, as Morella mentioned before, it is one of the only entry-level roles in psychology that you're actually implementing treatment. You're working hands-on, you're implementing treatment, changing the lives of children, but at the same time, obtaining that experience with yourself to figure out, oh, is this a subset of population that I want to work with? Is this the part of psychology that I really want to work with the rest of my life? And so it is a really good opportunity to get experience, as well as use your undergrad degree to see kind of which path you may want to take.
All right, thank you. So we have another question from Jackson. Can we specify how to get involved as an undergraduate? Is this an internship type availability, or does this entail becoming certified? Well, I can say I've had plenty of students do internships, well, with mostly little leaves in the room right now, but we did have one or two with behavioral framework as well. And maybe you could speak to that, because I know that there's an extensive training program, and sometimes calling in an internship can be a little challenging because you want someone working with the child or the adult that has a little bit of staying power, that's not going to maybe go away in 3 months. So maybe you can talk a little bit about if you offer internships and how that process would work.
I can speak to that for behavioral framework. So you're absolutely right. I think in terms of the clinical aspect of an internship, when we have people coming to us interested in working with our clients and families, it usually is a process where they become an employee of ours, specifically because the amount of time and training and dedication to getting this person up and ready to go and established on a case and introducing them to families. It's a lot more detailed than just having somebody come in and out for a couple of months. And so we try to avoid that disruption to our families. So if we have people interested in joining us to work with our clients, we usually set them up as if they were an employee. And they work with us for as long as they can. And they receive the same level of training and oversight and supervision as any other employee at Behavioral Framework. We have had people reach out to us regarding administrative internships, office-based things, and those are usually just kind of case-by-case basis based on our organization's need.
We operate very similarly at Little Leaves, mostly for that continuity of care for our families, as well as the intensive training that's necessary. But something that does work really well for those that aren't sure if they want to jump on for a full-time role, are our part-time opportunities. You are an actual employee with, it sounds like behavioral frameworks as well as with Little Leaves, but the part-time opportunities may be anywhere from 10 or 15 hours a week, or up to 30 hours a week, depending on the setting that those are. And so you're able to balance other things, get a taste of what this is. We do always ask, and probably similar for you all at Behavioral Frameworks, is we ask for a 1-year commitment. We hope for that. It's a verbal commitment, but we do know that sometimes, you'll come this way, you'll see how it is. And if, 9 months in things change, that's fine. And we have had, and I hope we do this more, Steve, in the future, there were days where buses of UMD students would come and just observe. And so that was an experience in itself that's definitely valuable, but different. So we're always open for that.
And that was a lot of fun too. I miss us. We tried reaching out to, but I should have reached out to Little Leagues, you folks. Everybody kept saying no to us. We were trying to get that back up and running, the actual physical going to places again, but we got a lot of doors shut because of COVID hangover and such. Thank you. By the way, students, you can call a part-time employment experience as far as the university and psychology department is concerned as an internship. So you could do that experience for academic course credit, even though you're getting paid and even though the organization is recognizing you as an actual employee, which is a good thing. Ethics was mentioned earlier. That's really ethical because you're performing the work of a ABA therapist or a behavioral technician. So there's some ethics involved with that about getting paid for that work as well. So you can be a part-time paid employee of either of these organizations and still be earning academic course credit and calling it an internship. All right, so our next question kind of goes along those same lines as, are there any, and maybe Morello or John could really speak to this first, is there any coursework as an undergraduate that you recommend students take that are thinking about maybe a career path or an advanced degree in ABA therapy? And other than the obvious of maybe doing an internship in ABA therapy, are there any other experiences you can think of that would be beneficial to an undergraduate looking to maybe go into your field?
Marla, would you like to start?
Yeah, sure. So I know at UMBC that we have a series of courses that are specifically in behavior analysis. I'm not going to talk about each one in detail, but I believe we have 4. So we have a 200 level course that is probably the first one that we would recommend taking. It's called Psychology of Learning, and it's just an intro level overview of behavior analysis. I was actually just teaching this morning, and my students and I played a game learning how to shape behavior, which was a lot of fun. So I think it's good to take those courses for a couple of reasons. One, along the lines of what Erin was saying earlier, it gives you a feel of the science behind what you would do clinically, and you can get a sense of whether you like it or not. I think some people are naturally drawn to data-based decisions and hard sciences in general or natural sciences, others are not. So I think taking those courses can help you make an informed decision. But also, if you do decide that you want a career in behavior analysis, taking courses in behavior analysis will make you more competitive for graduate school and beyond. The other thing I would say is that many universities offer beyond the coursework, there are research opportunities, and you can take credits for being a research assistant in labs. So what I always recommend my advisees is, look at professors, like at their web pages, see if anyone's research seems interesting and reach out to them. And if you're lucky, they may have openings in their lab, and again, you can take academic credit for doing research work. You can get more hands-on experience with behavior analysis and create relationships that can, be very meaningful for your professional development. And just to give you an example, in my lab, we focus primarily on language development in kids. So my doctoral students go to a preschool, they conduct research, basically trying to learn better ways to teach language. And my research assistants, who are all undergraduates, they come to the lab and they get a lot of hands-on training on data collection, data analysis, and then as they become more senior, training other new research assistants, coming up with their own projects. So there are a lot of opportunities for professional growth in a research lab. And getting some research experience will also make you more competitive for graduate school. So I'll stop there, but is there anything you want to add, John?
That was great. I would say also that the experiences that Dr. Singer described in terms of research and or clinical practice will also position you very favorably to get good letters of recommendation from behavior analysts. So when you're applying to graduate schools and you're pursuing additional training, letters of recommendation are going to be an important component of that. And we like to hear from folks who can speak to your ability in terms of the practice of behavior analysis and or in terms of research.
All right, thank you so much. We have another question from Dylan. And Dylan is asking, what would you say to the significant portion of the autism spectrum disorder community who actively speak out against ABA therapy as cruel for teaching children with autism that their natural behaviors are wrong and they need to act normal? Things like make consistent eye contact, regardless of how harmful that is to the children.
I'm sure everybody would like to respond to this. Does anybody want to go first? I think this is an important question, and I'm grateful for Dylan for posing it. I will not speak for everyone on this panel, but I have a sense that we're going to have very similar responses. It is my position that our goal is not to change an individual from who they are at their core to resemble anything close to what others might call normal. So I want to be very clear in saying that that is not our aim. What we want to do is work with children and their families to work on important changes that are going to be beneficial to the child and to their family. And I was just in a course today where somebody posed this very same question. What do you think about the role of asking children or trying to teach children to make eye contact? And my response to that question is, I personally sometimes struggle to make eye contact during conversation. So if this is a skill that I cannot exhibit reliably, then it wouldn't be something that I would want to target myself to try to change the behavior of another individual. With regard to the description or framing of these procedures as cruel, I would certainly want to suggest that the procedures that we want to implement are not cruel. We don't want to force individuals to do things that they are not inclined to do. We would like to set environments up so they're motivated to engage in habilitative, healthy, therapeutic behavior change. And I'll stop there because I'm sure others would like to weigh in on that one.
I also want to add, I think that was amazing. And I also want to add that just like any other medical or professional field, there's going to be good clinicians, there's going to be bad clinicians. And every field enhances and develops over time. And our technology improves and our systems improve and how we approach treatment improves. And I think that it all comes down to, again, it's not about changing the person, but it's identifying what is meaningful, because you could find a family who wants their child to make eye contact because culturally or whatever, that's something meaningful to them. And so to that family, that is a socially significant behavior. And so I think the best thing about ABA is that everything is done and it should be done in the context of the individual's environment. And what is socially significant to one person and one family is not going to be socially significant to another person and another family. So you could go down rabbit holes of, what is good, what is bad, what is, all of those things. But I think it comes down to the individual and what type of change you're trying to make for them and for their family.
Just to add on to that, for our kids, we always say that as long as it doesn't interfere with their learning or their growth. So for everything that we do, as long as, like, let's say eye contact is very important, and we might not think that it is, but if you think about it in a safety concern, the ability to respond, maybe not with eye contact, but if you're running off in the street and we're saying like, hey, Ethan, so they're gonna need to turn around. So it's a matter of priority. whether or not it's socially significant or if it's a safety concern that is affecting their learning and growth.
All right, thank you all. So we're coming up on our last question, our final question. So if any students, if you have any more questions, please drop them in the chat box. We'll have a couple minutes to get to them. A final question is, what personal qualities and professional experience do you look for in, say, hiring ABA therapist or behavioral technician? What are the things that you look for personally?
So I can answer this. So at Behavioral Framework, and this varies from organization to organization, but I can speak to what we do at Behavioral Framework. We strongly believe in the goodness of fit for the client and their family. So ideally, we're looking for qualities such as being motivated and eagerness to learn, having some type of background experience working with children or in a related field, so that we are matching the client with the technician that makes the most sense. So it's really about what the client needs. Some clients need someone who's a little bit more energetic and bubbly. Some clients may not like that or may not be responsive to that. And so it really is just determining based on the client's needs as well as the technician's skill set, what the best match would be.
And to piggyback on that, like I said before, we always are looking for people that just really love working with children. In ABA, I think we can all speak that we do a really good job at training people how to implement. So if someone has an eagerness to learn more about the field and loves working with children, then we'll be able to teach how to implement. Part of our interview process is observing a session and being part of a session, so that you as an applicant or someone interested can see what it looks like, because not everybody thrives in a dynamic environment with more than one thing going on. And so that's something that we like to pose to anyone interested too. It's a very dynamic on-the-go environment. And so, you know, whether you thrive in that or whether that's not your comfort level, that's always something we try to be honest about, to see where your interest might be as well.
All right, we have a wonderful final question here from Hannah-Lise. Hannah-Lise is asking, what inspired you all to focus on ABA and go into the ABA therapy field?
So I went into ABA because it was a more personal reason. My cousin has autism, and I guess in a way I wanted to learn more about it. I started taking psychology classes, started talking to Steve, and then I realized I wanted to learn more about it. So I took the leap, called Little Leaves, and then I ended up working as a technician. And through that, I've just learned more and more about the principles of ABA. And I discovered that I am actually passionate about the field, and I wanted to, you know, work with kids or even adults, and just human beings for the, you know.
Yeah, I do this, not a panel discussion. I've actually done this for our students as well, but I usually have an invited speaker every semester to talk to our students about their path, because I think it's so useful for students to, first of all, learn how people got to do the jobs that they do and what they love about their jobs, but also realize that not everyone has a straightforward path. Actually, I hardly know anyone who did. So, so that was a great question. I'm glad that came towards the end, because it's probably a good way to get closer to ending the panel discussion. But for me, I was an undergraduate student and I wanted to start working, and I really wanted a job in psychology. And I happened to have two job offers at the same time. One was to work with a child with autism, implementing behavioral interventions. That was back in Romania, where I'm from, or to work in an HR department. And I knew nothing about behavioral psychology, but I like it. So I thought literally that was what what was involved in my decision making. I like kids, so I can give this a try. And I really fell in love with it right away, not just because of what we talked about in terms of seeing the behavior change and seeing kids get better and family dynamics improving, and that is hugely important. But I really wanted to know more about the science behind it, why it works and how it works. So that led me to apply to a master's program in behavior analysis. And during my master's program, I think that's when I got really, really hooked with the science. I think just really understanding how behavior works and how you can change it is fascinating. And to this day, it's probably the most rewarding thing for me. So initially I wanted to be a clinician, and then that's shifted to wanting to be a researcher and a teacher because I wanted to be actively engaged with the science. And I'm very lucky to have a job where I can do that. But it was not straightforward. One thing kind of led to another, and that's where I am today.
Mine was a bit of a career change as well. I'll keep it quick. I went to undergrad to teach. So I taught math and science, and I loved physics. So that was awesome. And then I realized a handful of years into teaching that I just really wanted to be able to focus more on the behavior. It's hard to teach if a classroom, so group environment or an individual, isn't ready to learn. And that's where eventually I learned about ABA. And so now I feel super powerful at times when I have that kind of teaching. For those of you who might be interested or in education, these days there are often now ABA courses to help teachers be better teachers. And so psychology is awesome, but there's sometimes kind of both in both worlds, which is really neat. And that's kept me, I've stayed in the ABA world because I love the science and the application of it as well.
All right. Well, we want to thank all of you for your time this evening. We'll give you a virtual applause. And Gabe, if we can put up the thank you slide, that would be great. And I want to put this out to all of our panelists. Please feel free to reach out to myself or the Feller Center or the University Career Center as to how we can continue to support your mission in different ways. We would love to do that. So we have, the panelists have been generous enough to allow us to share their information. So we have a slide up here. You're welcome to take a picture of it, snapshot of it with their email address if you want to reach out to them for any further or additional questions you may have. And then we want to put in a plug for some upcoming events that we have. We have next week an industrial organizational psychology event. And following that, in the first week of November, on November 1st, we have a grad school panel, Mastering Your Master's Degree Grad Schools. So if you put your phone up to either the QR codes, you can RSVP for either of those events right now. Thank you again to all of our panelists. We really are appreciative of the time that you took out of your busy schedules to be with us, and obviously all of the knowledge, expertise, and information that you shared with the students this evening. Thank you, thank you, thank you so much. And I want to wish everybody a healthy and happy evening. So with that, we will conclude. Everyone have a great evening.